Nearly 1 billion people have poor access to essential healthcare, particularly in low and middle income countries, where households face financial risks from illness. These global inequalities result in preventable illness or death, not only because of lack of surgical procedures and medication, but also because of ineffective incentives to seek care or to prevent disease. And global health is urgent, particularly in a time where several high-income countries have reduced their budget for global health research and education. This is ESHPM Research in the Spotlight, and I welcome Matthias and Igna, our experts in global health, and also participants and the director of the Rotterdam Global Health Initiative. You will share what we can do and what we contribute to solve and support our global health program. Matthias, could you please explain and introduce your topic first?
Yeah, so we have a global health behaviors lab, and what we do there is we test economic but also behavioral interventions to improve health outcomes and to support health behaviors. And we do so in low and middle income settings with vulnerable populations such as children, adolescents, but also, for instance, at the moment with tuberculosis patients in South Africa. And we do so using randomized control trials and field experiments to provide very rigorous evidence, testing different options, interventions in terms of impacts and also then ultimately cost effectiveness.
And Igna, you're also the director of the Rotterdam Global Health Initiative and mainly focusing on international healthcare systems. Can you elaborate on what that means?
Yes, very happy to. So with a team of international PhD candidates as well as other researchers, we work on understanding what works in healthcare systems. So if specific countries decide to reform their healthcare system, maybe they want to move to a new type of health insurance, or they want to identify a new way to pay doctors and nurses, then we evaluate the effects of these reforms and try to formulate that in such a way that it creates a lesson or helpful information for policymakers in other countries that hope to do the same.
Okay, thank you. Maybe you go back to Matthias for a second. I mean, could you provide an example of the work that you do, maybe on TB?
Yeah, absolutely. There's so many examples. I'm very passionate about the work we're doing in the Health Behaviors Lab around tuberculosis. So TB remains a big problem in the world. Over 1 million people die of the disease every year. And that's a big tragedy because there's a lot of cure available, effective medication, but still a lot of people die. So there's a lot of preventable death. And the reason is that tuberculosis often comes with poverty, malnutrition, income loss, and also behavioral factors such as stigma. And we're trying to come up with new approaches to support patients when they onboard to their treatment to get well and complete the treatment, which can be quite long. It can be around 6 months. So it's a long journey, and we're trying to find new ways to support patients.
So maybe to clarify, TB means tuberculosis. I mean, not everyone is aware of these abbreviations. But could you explain, I mean, you work in South Africa, for instance, could you explain how your research is going to make impact in South Africa?
Yeah, that's a good question. So in South Africa, specifically, it's one of the leading causes of death. And if you look at it at face value, there's good medication available. It's medication that's available for free to patients. Of course, they still incur costs because they have to travel to a clinic and so forth. But in principle, the care is available. Now, the problem is that often patients do not complete the treatment, or they might forget some pills here and there. And even forgetting a few pills can have impacts on becoming healthy at the end of the treatment journey. And that's a tragedy because that can be potentially lethal to the patient themselves, but also can impact others around them. It's an infectious disease. And there can also be a problem that if the treatment is not followed properly, there can be medication resistance. And that's a big public health problem all around the world. And what we're trying to see, what could be some factors why patients are not completing their treatment? And then we want to come up with interventions specifically. And what we are focusing on with partners, Stellenbosch University in South Africa and the Orem Institute and local stakeholders such as local governments, but also communities and clinics, is to improve medication adherence, because a lot of patients, they have many other worries in their life, so they might forget the medication. But at the same time, there's also problem that some of them might not want to take the medication on an empty stomach. So we are developing interventions to address some of these factors, and that's how we hope to make an impact.
Maybe extending that question. So as ESHPM as a school, what is the contribution that we as a school could make to make impact or benefit in society?
Well, concretely in this project, we contributed a lot of health economic, but also behavioral economic expertise to design a mobile health application that's running on WhatsApp that actually helps patients when they're on treatment to, they get reminders, they get information on TB, they get reminders when they have to go back to the clinic. And so we have provided a lot of expertise designing this application using behavioral economic principles, but also making sure that from a health economic point of view, that intervention could be potentially scaled so that it's designed in a cost-effective way. And then we also test it in a rigorous way. So this is kind of the expertise of ESHPM, I think, in this specific case, where we can add a lot.
Thank you. Okay, Igna, so we've seen devastating cuts in development aid in many countries, including the US and even in Europe. How do you think, as ESHPM, we can support or contribute through our research and education to maybe at least reduce some of the effects in global health?
Yes, it's indeed clear that a lot of high-income countries have decided to invest less in global health. And I think that researchers and educators here at ESHPM are swimming against the tide. So we are actually focusing on the importance of global health. And I do think that with external aid for health being reduced, there is an important role for especially African governments to step up and identify additional resources for health. But it also provides them with an opportunity to define priorities, take ownership of their healthcare system. And I do think that the research we do here provides insight on what could be reformed and which improvements could be made on the path towards universal health coverage, which we hope as a world to achieve by 2030 as part of the Sustainable Development Goals. So yes, there is a clear crisis, but there have been crises in the past as well when it comes to global health. So I do think that through our research, we can inform policymakers and help them increase access.
I sense a bit of optimism, which I'm very grateful about. Thank you very much. I wish you all luck and making sure that we do make that impact. I also hear you talking about education. Can you please explain a little bit further about what we do in education for global health?
Yes, I think we have a very exciting set of different courses that we teach to our bachelor and master students. And while we would have probably half of our student population based in the Netherlands, we also have quite a set of students who originate from elsewhere in the world, whether it's high, low, or middle income countries. And I think many of them will go on to become policymakers in their future roles. And by informing these students about what are potential routes to strengthen healthcare systems, but also how to evaluate these reforms, we can, through our education, support strengthening of healthcare systems.
Nice. Do you want to add here, Matthias, on the education?
Yeah, absolutely. So a lot of the education will also play out in collaboration with partner universities, where some of the teaching might happen in partner countries and partner institutions, some of the teaching here in different forms. And I think that's the model also moving forward, to have more integration between universities and teaching, and also specifically then link that to the research that we are doing. So if we are doing a research, for instance, on tuberculosis in South Africa, are there linkages we can do, for instance, to integrate master students in there to write their thesis on parts of the data that we collect and so forth, and have really genuine two-way collaboration with our partner countries.
Nice. So I'd like to move on to the Rotterdam Global Health Initiative, which I'm very pleased that we have this initiative in Rotterdam and The Hague, because RGHI is a collaboration between the School of Economics, the Erasmus Medical Center, and the ISS in The Hague and ourselves. Igna, you're director of the RGHI. Could you explain a bit about RGHI, what the intentions are, the ambitions?
Yes. I'm very proud of the members of Rotterdam Global Health Initiative. There are about 250 members, and these are both academics based here at Erasmus University, but there are also academics who are based at a range of universities locally and who have sought our expertise. I think that has created an opportunity for learning in both directions. So we often talk about capacity building, but I think it's more sharing capacities from both sides. And the network allows for those based here at Erasmus University to learn about what others are focusing on, but it also allows us to showcase the work that is being done at Erasmus University. And that creates an opportunity for potential funders, for policymakers, for other academics to reach out to us and to know how they can find us. What are the topics that we mostly work on? And these topics are basically three. So members of Rotterdam Global Health Initiative work on the social and environmental determinants of health. So that's basically how to prevent people from needing healthcare. Then there is a group of people working on healthcare systems, how to ensure access to good quality healthcare for everyone. And then finally, there is disease modeling. So this is about understanding the ways and also the speed at which, for example, infectious diseases can spread through a smaller or larger area. So these are the three areas that Rotterdam Global Health Initiative is active in.
Fantastic. We've been talking about South Africa and the tuberculosis case for some time now. Are there any other collaborations or events with other countries that we do organize?
Yes, definitely. And we always try to set up equitable partnerships to ensure that we can really focus on the needs that are there locally in terms of research and education. And one clear example is the work that we do together with partners in Indonesia. So recently we organized an event with the Rotterdam Global Health Initiative where the early career researchers, who two of them are actually from Indonesia and also work on the Indonesian healthcare system, initiated an event on the occasion of the 10-year anniversary of JKN, that's the insurance in Indonesia. And what we did is we had a delegation from University Gadjah Mada visited here in Rotterdam. And we exchanged insights about lessons learned of 10 years of health insurance. And we are organizing a follow-up meeting where it's a delegation from Erasmus University going to, in this case, Bali, and to then continue the conversation and further identify what are the most important challenges to the current health insurance, which is the largest health insurance in the world. So you can imagine that there are lots of countries, take for example Tanzania, that would love to learn from the insights that Indonesia has generated.
Maybe a final quick question to both of you. I mean, if people have to remember you because of your research, what should we definitely remember and recall or call you for, Matthias?
Well, that's a tricky question, but let me be brief. So one thing that really comes out also from our work on tuberculosis in South Africa is that often you might have the right medication or health technology in place. That doesn't mean it's going to be impactful because you are dealing with people. And so you need to understand kind of the economic and also behavioral mechanisms around to really then think of how can we make the medication more impactful. And then often we're talking about designing different interventions, for instance, to support patients. And then we also need to make sure that because resources are limited, that these interventions could be scalable in a cost-effective way. And that's really something close to my heart, at least. And
Thank you. And Igna, and yourself?
Yes, so I think that there is a lot of premature mortality from all kinds of diseases that we know how to prevent. And medical science has done such an excellent job in identifying all kinds of prevention and treatment, but there is a very large share of the population that is not being reached by those interventions, and we try to identify how those effective treatments can reach those who are in need.
Well, thank you very much, Igna and Matthias, for joining me today for this conversation about the contribution of ESHPM and global health. And as you see now, as we've learned, is that global health is not something, it's not an option to invest in. It's an essential asset for us to invest in with all the societal challenges that's playing around globally. And it's very much aligned with the mission of Erasmus University to make positive societal impact. So thank you very much for joining. And with a world dividing more and more, it's absolutely critical and essential, in my view, to continue to invest in this global health theme as a program.